The idea of how you improve people's health versus treat their illnesses or diseases. And we have a lot of good strategies now that can really be beneficial for people. Several of my patients said, well, what do you do for yourself? How can you make it more affordable? So this is my stab at that, and to tell you what I do for myself, and also how I think I've tried to make it more affordable. And we've had a vitality program since about, I think, 2005, if I'm not mistaken, in various iterations. So this is the newest iteration. Let's see if this will. So the sense of well-being is a function of the efficiency of energy production. Oh, let's turn these lights off. Oh, will it work if you turn the lights off?
Yeah, go ahead, it's fine.
Because the pictures are nicer. and factors that support the efficiency of energy production are adequate rest, the quality of your sleep, regular exercise, and different types of exercises, particularly ones that help as we get older to preserve muscle mass and bone mass. Healthful dietary practices, which shouldn't be rigid, but should be comfortable and trending in the right direction. It's crazy, I think, to be too rigid about any of it. Conditionally essential supplements and adequate oxygenation. And factors that impair efficient energy production are stress, either psychological or physical, poor nutritional practices, lack of exercise, toxic burden, which is very real and unfortunately becoming more alarming, infections, other chronic illnesses, medications, and other over-the-counter things we do too much of, like alcohol and all the illicit drugs, and now the legal drugs, like marijuana. And this results in poor tissue oxygenation, impaired oxidation reduction function or redox function, and let's say unhealthy aging, where you lose your reserve, you lose your ability to respond to stress, so you lose your resilience, and that's sort of what happens when you get old, is you lose your resilience and you become a little less able to kind of prevent yourself from tottering, either metabolically or even physically or psychologically. And you lose your sense of vitality and well-being. So the Vitality program is not designed to treat a disease. We're not interested, at this point, there's elegant treatments for disease. Our goal is to improve overall health and well-being, and the result is greater functional capacity and resistance to the adverse effects of illness and normative stress and aging. So, you know, balance is the key to life, and you don't have to go overboard. You could just, but we're talking about 7 areas of activity that we engage in. One is diet and dietary therapy. The other is appropriate use of nutritional supplements, and have tried to find places where the literature suggests a real value for people, and then figure out how we could track the effect of whatever they're doing to make sure that it's worth continuing it. Herbal therapies, the adaptogenic herbs are really wonderful in terms of optimizing aging, helping to improve resistance to stress, and helping to manage chronic illness. Regular exercise, physical therapies, the energetic therapies, which we'll talk about, like the lymphatic enhancement, and Pat will talk about that, and the self-regulation therapies. So I'll briefly go through those things, and then we'll have Carrie, Pat, and Casey go through it. Jonathan can't be here to talk about physical therapy in the gym, so I'm going to talk about some of the things that we have on his behalf. So Carrie's going to talk about first-line therapy, and Carrie and Jen Lipkin are our nutritional counselors, and I think we've created a nice program. Again, it's not extreme. We try to work within the context of what people can afford in their insurance, and then we try to individualize the programs for people over time. So, and Carrie will speak a little bit more about first-line therapy. And some of the principles that seem to be enduring are to maintain a necessary and minimal caloric intake. It seems that eating on the lower side of caloric necessity has value in terms of not stressing ourselves metabolically and not weakening our reserve and our resistance. And eating nutritionally dense foods, vegetables, fruits, legumes, nuts and seeds, lean meats and animal products in small quantities, and moderate protein-rich foods, and minimize the calorie-dense foods, the carbohydrates, the bread, rice, pasta, potatoes, candies, soft drinks, alcohol, and fat-rich foods. And then avoid the toxic foods, foods high in the saturated and trans fats, foods that are highly chemicalized, like things that have long shelf lives in the grocery store, and foods that have a lot of hormones, preservatives, and antibiotics in them, which is a lot of the sort of non-organically raised animal products. And you don't want to take so many supplements that it looks like this, and you become like this. But you know, it's hard to create, I think, what is the right balance. There are enthusiasts who only feel well when they have. I've had people come in with suitcases full of supplements. But to use them in moderation to support good diet, etc., I think has value. And you know, there's support for cardiovascular health, support for oxidative stress, support from stress from toxic burden, support for neuroendocrine balance, energy efficiency, neurologic health, and psychologic health. And I've tried to figure out, you know, be a minimalist, if you will, in terms of trying to, you know, sort of being satisfied that if I could find products that would help 90% of the people, you know, I can't be perfect, but that in terms of their safety, their potency, you know, the quality, their purity, that we would be able to do a good service for people. So, and in some people who are, you know, in the, let's say, rescue or transformation stage of getting help from us, large amounts of these products can be helpful for a while. And you know, that's why we have the pharmacy access program, etc., to help make it affordable to people. Maybe I did something wrong.
There you go.
Herbal therapy, you know, is really a traditional therapy, and I think of it as sort of helping to optimize our balance, our resilience, our ability to tolerate stress. And I think of it as more than taking pills, but of incorporating good herbal products in the beverages that we drink and the foods that we eat. Over and above that, we're fortunate to have a very skilled and well-trained herbal therapist in Carrie Connell, who can work with our patients and really does a great job, and you know, has integrated her practice into our regular medical practice so that we can try to constantly work on reducing doses of prescription drugs and helping people feel their very best. But in each of these areas, there are products that seem to have reasonable and reliable benefit. And I tend to fall back on them and have a fairly more and more limited, if you would, range of things so that I don't overwhelm myself and I don't overwhelm the people who come for advice. And to make that process easier, the diet nutritional process, the nutritional supplement component, and the herbal component, we have the Apothecary Access Program. We first created it because there were people who had very serious illnesses, let's say cancer type illnesses, etc. And there are people who I trust to be honest brokers in terms of the recommendations they made and the way that they teach the value of using supplements and herbal products and helping people with cancer manage well. But regardless, the cost is very high. So what I wanted to do was to remove a moral concern about profiting from people's, difficulties. And so the Access Program is a way to achieve that. People pay a fixed fee for access to the products at the apothecary at the wholesale price. The wholesale price means the cost of goods and the cost of operation. So I have to pay my staff and pay the space, but we don't profit from the sale that way. And I think that that's allowed many people to, over the years, to stay on these very complex and somewhat expensive programs at considerable savings, and has facilitated that process for them. And Lynn can speak to people individually if they're interested in it. Oops, I think I went too far. So this is Jonathan's part of the talk. Many of you are familiar with the gym and the physical therapy facility we created downstairs. And we have regular physical therapy, and then we have what I would think of as some things that are a little bit special. An anti-gravity treadmill, so that for people who have injuries that are lower extremities, or neurologic illnesses where gait is a concern, where fall risk is high, this treadmill is really a wonderful way to help rehabilitate people. So I see young people in their 20s who've hurt their legs running on it. I see 80-year-olds walking on it. Because it's that continued activity that preserves muscle mass, that prevents the inevitable decline with aging. Then we have a special strength training device that helps to build bone mass and muscle mass. And while I can't say there are no patients who need to take medicine to build their bones, I think we're able to work pretty hard and demonstrate that if people give us 1 year, they can show a nice interval improvement in bone density without taking a medication. Whole body vibration, we'll go into that. Oxygen multi-step therapy, far infrared sauna, the ozonated steam bath, pulsed electromagnetic field therapy, the strength training, and the normal aerobic cardio. So the Alter G is a treadmill that reduces gravity's impact by selecting any weight between 20 and 100% of your body weight. And it helps to rehabilitate lower extremity injuries with less pain and impact, improves mobility, strength, and safety for those with orthopedic and neurologic conditions. You can train without pain and reduce the stress to your joints and muscles. So having personally benefited from it, I can tell you that it's a very good way to help bring you back to full function after an injury, or if you do have some disability. And it's a safe way to lose weight and exercise more intensively while unweighted. People like aquatherapy, but in aquatherapy you don't get as much gravitational stress and you don't get to normalize your gait. So there's certainly great benefits to aquatherapy, but it doesn't normalize gait, and it doesn't allow you to progress gravitational stress so that you can go forward to just being able to walk or run on the street with. So the biodensity device is an interesting device. If you're on a height of like 3 feet and you jump down, there's a very brief transient distortion in the bones and muscles, but particularly the bones, and that gravitational stress builds bone mass. So they created a device that would help do that in these brief 5-second isometric resistances that help to build bone mass in positions that minimize the risk of injury. We always have one of our PT assistants or trainers helping people with it to make sure their posture is correct. But it improves the bone density and the health of the bones, because a lot of the therapies that we have to increase bone density create bones that are kind of brittle. Now, there are other therapies that are quite good, but they're terribly expensive and not without side effects. So if we can demonstrate in a year a significant improvement in bone density, which I feel confident in most people we can do, then we can avoid those therapies and the crazy costs. It improves functional strength and joint health, and it improves body composition and metabolism. And when you're improving body composition, we're always meaning building muscle and losing fat. Or at least, yes. So when you build muscle, you raise metabolic rate, because muscle's more metabolically active than fat tissue. So there are these simple principles to keep revisiting at any age, but particularly as we get a bit older. So there's been a recent research study. This study showed bone density gains that averaged 7% in the hip and 7.7% in the spine over a year using biodensity. That's phenomenal. And by contrast, one of the bisphosphonate drugs, the Boniva, clinical trials found a 3.1% gain in the hip and 6.4% in the spine over a 3-year period. And again, the quality of the bone wasn't as good. It's the more fragile bone. So with triple the amount of time the drug intervention fails to match what biodensity osteogenic loading can do by stimulating the natural bone regenerative process. In whole body vibration, it's safe, it's effective, it's shown to increase muscle mass, muscle strength, and bone mass while reducing fat. It reduces the catabolic stress hormone cortisone, thus reducing both an effective stress and a stressor. And it's shown to improve stability and reduce fall in the older people as we get older. And I think one of the things that's interesting here, people are always asking me about adrenal fatigue and adrenal stress, and they're always looking for a new pill. I mean, you have to understand, I've been looking at this phenomenon for 40 years. They're always repackaging the same stuff in these vitamins. I think the adaptogenic herbs from Natura are really of the best. They're the highest quality. They're potencies that really work. And I'm just going to stick to my guns. If you want to go to someone and get the newest version of the same thing, you're welcome. But you can do an awful lot on normalizing hypothalamic pituitary adrenal function and dysfunction by just standing on this thing for 10 minutes twice a week. Next. And there's good literature to support it. So the VibraFlex technology is FDA in clearance as a Class 1 medical device. It exercises postural muscles, joints, and reflexes, improves muscle strength, reflexes and joint motion, and redevelop postural muscles, joint, and reflexes after injury or disease, reduced incontinence by strengthening pelvic floor muscles. So we have an incontinence program that utilizes whole body vibration, pulsed electromagnetic field, and LET, instead of all the pills that they're pumping at you and the surgeries. Not to say those won't be useful for some people, but I think we have alternatives that really are meaningful. And I don't think that the cost of it all is much greater, than the cost of, I think the pills cost more. It slowed the progress of Parkinson's, improved leg circulation for people with diabetes, and reduce the pain and disability associated with osteoarthritis. It also helps peripheral neuropathy. And the reason is, if you've ever been on the VibraFlex, you'll feel your legs kind of tingling. Your feet, they're tingling because the very tiniest blood vessels have been dilated. So it optimizes blood flow to small nerves. And, capillary, while they say, well, your pulses are okay, you don't have major arterial disease, you can have small vessel disease that we can't really measure, but contributes to peripheral neuropathy. And time and again, we've had very nice improvements for people with this therapy. Next. Okay, this is a little movie thing. I don't think there's sound, but this is live cell analysis is real. It's just not, its use has been by, anyhow, these cells, this is red blood cells. You see how they're all stacked together? That's considered sludging in an unhealthy state. So when you're old or you're ill or you're dehydrated, this sludging is how it is, and the delivery of oxygen is compromised because, as Jonathan likes to say, if you're delivering food to people and you stack one plate on top of the other, you can't get much food. You only can get food on the top of the plate. So you'll see this is the rouleau issue in blood that's in people who's maybe not so healthy. So Termbisonic is the second type of vibration device we have. And this is what the red cells look like after that. They've separated, they're just not as sticky. And the environment is more alkaline, which is a healthier environment. Still some sticking together. So they redid it, I think, 5 minutes later. You'll see that in a second. And you can see there's even greater, there's a process of improvement. Now what I don't know is how long that lasts for, but this shows you what a healthy, red blood cells in a well-hydrated person is like. The oxygen multi-step therapy was developed in Germany in the 1950s and 60s. It became popular for a while and then fell out of popularity, and I'm not exactly sure all the reasons, but it is a service we offer in the medical gym, and for some people it just helps them to feel much better. We do a test, I do a test where we can look at the difference between the arterial oxygen level and venous oxygen level. And when that level is less than 50, it's really valuable to do this. And it lasts. In other words, if you do it for a month or 6 weeks, the benefit could last for another 6 to 8 weeks before you'd have to do it again. But it's just part of riding on a bike. You put the oxygen on. It supersaturates the blood and tissue with oxygen. It improves aerobic capacity more quickly than regular exercise. And particularly useful for people who cannot exercise vigorously because of age-related reductions in conditions or chronic illness. It does not require excessive effort and thus does not produce post-exercise fatigue common to individuals with chronic fatigue, obesity, and aging. Next. Takes about 15 minutes on an exercise bicycle while breathing 100% oxygen. It's best done 2 to 3 times a week, and 30 years of research in Germany showed it to be safe and effective. And once there's an improvement, it's sustained, so it lasts throughout the day and weeks. We have an infrared sauna that's, I think, a wonderful way to support the detoxification processes in our body. It's very relaxing, obviously. It's a smoother heat than regular sauna heat. It helps lower blood pressure, and it helps improve skin quality. There's clear evidence that it improves cellular health. I will do, for some people, oxidation therapy, where there's a transient oxidative stress that helps build redox processes in people. And it sets in motion the reversal of chronic oxidative stress, which impairs mitochondrial function and thus contributes to fatigue, chronic disease, and obesity and aging. Right now I'm just using an ozonated steam sauna, which works quite well and is very safe and just part of the services in the Vitality program. What happens is the ozone complexes with fats in the skin and creates ozonides, which are free radicals that then stimulate the body to enhance its antioxidant processes. And it's beneficial for a lot of conditions. We've helped people with chronic skin infections, poor circulation. The macular degeneration has been very interesting. The steam sauna doesn't help that, but I do an IV hydrogen peroxide drip. And I can't say every single person's been helped, but when they have mild to moderate macular degeneration, we've had people who were able to start driving at night when they couldn't. So, you know, it's like every other therapy. It works sometimes. It's not perfect. It's not expensive. But it can be a very pleasant way of helping people when they're struggling with these various issues. Next. Pulsed electromagnetic field therapy is very interesting. The way I got interested in it was that I had a patient who had spinal stenosis of her lumbar spine. And she'd reached a point where she really couldn't clean her own house or do her housework or cook. So I said, I think you're going to have surgery. And so her husband is a physicist. He worked with NASA and everything, and they kind of came up, they found this device. And she came in 3 or 4 months later, and I said, how are you? And she said, my pain's a lot better. I said, what did you do? And this is what she did. So I immediately bought one. It's very good for pain and inflammation from various conditions in a non-invasive and relaxing manner. It promotes a natural healing mechanism through optimizing oxygen absorption. That theme of getting oxygen to the tissues of our body comes up over and over again. It improves transportation of nutrients, promotes bone, nerve, and tissue regeneration. So there's actually programs, that's the third non-drug way to improve bone health, the PEMF, and a third way to improve gynecological GU issues. Very interesting, they have programs for benign prostatic hypertrophy in men with lower urinary tract symptoms. And it's just a natural support for the normative processes of our body that include the redox function, the detox function, etc. It really helps sleep. I mean, and then, you know, you sort of get, I don't know, I don't want to say addicted, but you start to miss it if you go a couple, 3 days without it, at least I do. And there's 2 devices we have. This device produces the highest Gauss or magnetic fields. They're pulsed magnetic fields, so they're not static, and therefore they're safe, they're stable, and they're beneficial. And it costs, I think, $13,000, but it works in 3 dimensions, and it's really effective in part of chronic pain. It's part of what the physical therapists use in managing patients, but it's also part of the Vitality program. This device is a Soma Pulse, which is a home device, which you can rent from us to see if it helps you. But it's a wonderful device because you can take it home, you can buy it. I think it costs about $1,000, but it's there. You have it the rest of your life, and it's very good. Like I have one guy who's a guitarist, and his thumb's very arthritic, and he did it for a while. He said, "Oh, I don't think it's working," so he brought it back to us. Then he realized it really helped, and he bought one. So there's mats that are less expensive, $2,000 or $3,000 that you can get for your home. I'm not saying this is the only place to get this, but this is the only place to get a magnet this strong. Next. And then we have the strength training equipment, which can be done under the guidance of our trainers and physical therapists. Next. And then there's the self-regulation therapies, which Casey will speak to. So there's Neuroptimal, which is EEG biofeedback. She'll speak at great length about that. But it fosters resilience and flexibility of your brain. And it really is a good way to keep our brain youthful. And it improves neuroplasticity. Next. And these are the general categories: wellness and personal growth, slowing the effect of aging, improving artistic and athletic performance, and then help with specific cognitive, emotional, and physical challenges, and then just wellness and personal growth. Next. And the lymphatic enhancement therapy, which Pat will speak to, is a wonderful therapy that many of you have experienced. I feel very lucky that I found it. But it's again, another wonderful way to support general well-being and vitality.